Good day, my name is Ethel from Bees and 3D, and today's video I'm going to perform the abdominal assessment. So for preparation, we assemble equipment or supplies needed such as the stethoscope. Now let's do the procedure. So first we introduce ourselves. Good day, ma'am. My name is Ethel a student nurse of the NETCOS, your assigned nurse for today. May I know your full name, ma'am?
Cruz Alice,
How about your birthday, ma'am?
10/12/2000.
Okay. After identifying the patient, we explain to the client what we are going to do, why it is necessary, and how the client can cooperate. So today, ma'am, I'm going to be performing the abdominal assessment where I'm going to be exposing your abdomen for us to inspect, auscultate, percuss, and palpate to determine any signs of abnormalities. So would that be okay to you, ma'am?
That's fine.
Okay, that's great. So after explaining the procedure to the client, we wash our hands and observe other appropriate infection control procedure. Assuming that we are already done washing your hands, then after that, we provide client's privacy. So after providing the patient's privacy, so first, we determine a client's history of the following. Ma'am, do you have a family history of abdominal pain, abdominal distension, and other abdominal problems, for example, surgery on the specific site?
No.
Okay, so last visit to the doctor for abdominal problem?
None.
Okay, so as of now, do you have a current symptoms of abdominal problem?
None.
Okay, that's great. So after determining the client's history, so now we do the inspection. We inspect the abdomen for skin integrity. To start with, we place the patient in a supine position. Ma'am, may I ask you to lie down because we're gonna be starting the inspection?
Sure.
Okay. So now that the patient is in a supine position, so we make sure that we drape the patient's lower extremities for full privacy. So especially that the patient is a woman. When I'm gonna be doing the assessment of the abdomen, so I'm watching like this. So we inspect the abdomen for contour and symmetry. So we observe abdominal contour while standing or sitting right at the patient's side while the patient is in supine position. So while inspecting, we ask the clients to take a deep breath and hold it. So ma'am, can you please take a deep breath and then hold it for a second, okay?
Okay.
Breathe in and hold it. Okay. So then after that, we assess the symmetry of contour while standing at the foot of the bed. So I'm going to be standing or sitting right here while observing the symmetry of contour. So if distension is present, we measure the abdominal girth at the level of the umbilicus. Then we observe the abdominal movements associated with respiration, peristalsis, or aortic pulsations. Then we observe for vascular patterns. So next I'm going to be doing auscultation, wherein I'm going to be placing a warm diaphragm of my stethoscope to each of the quadrants. So first I'm going to start with the right lower quadrant, then followed by the right upper quadrant, then left upper quadrant to the left lower quadrant. So first at the right lower quadrant, and the right upper quadrant, and left upper quadrant, to the left lower quadrant. I want to look if there is an abdominal aneurysm, so I want to auscultate the abdomen for bowel sounds and vascular sounds. So we listen for active bowel sounds for every 5 to 20 seconds. So starting with the right lower quadrant, the right upper quadrant, then the left upper quadrant, and the left lower quadrant. Okay, so for vascular sounds, we use the bell of the stethoscope over the aorta, renal, iliac arteries, and femoral arteries. So first I'm going to be showing you the part where is the aorta is on. So it is right under above the umbilicus. And then the renal is under right here. So iliac is under right here. So it's just below the umbilicus. And then here is at the left side. The iliac arteries is right here. Okay, so we are just listening for roots. Now we're done for the auscultation. Now let's do the percussion of the abdomen. So we percuss 4 quadrants starting from the right lower quadrant, proceeding to the left lower quadrant. So starting from the right lower quadrant here and percuss. Then to the right. So now we're going to be percussing the lip to determine its size, or 6 to 12 cm at the mid-clavicular line, or 4 to 8 cm at mid-sternal line. So we percuss liver below the umbilicus up to the lower part of the liver. So below the umbilicus. So now we're done the percussion. So now I'm going to be doing the palpation. I'm going to be asking the patient to change position so that it can be seen in the camera. So ma'am, can you please change position? So assuming the patient is still lying in supine position, but what I am showing you is that the patient is in side lying position because I just wanted to show it at the camera. So first we perform light palpation first for tenderness or muscle guarding. So just a light palpation. So we hold the palm of your hand parallel to the abdomen. So we depress the abdomen wall about 1 cm deep. So we move the finger pads in slightly circular motion. So we're going to be doing this.
We note any tenderness, ask the client to tell you about them, and look for patient facial expressions.
So okay, now we do the deep palpation. So we perform a deep palpation over all 4 quadrants. So we press the distal half of the palmar surface of fingers of one hand into abdominal wall. So we depressed the abdominal wall about 4 to 5 cm. So normally tenderness may be present, so near the siphon process, over the cyclum and over sigmoid colon. So check for rebound tenderness at the areas of pain, which indicates peritoneal inflammation. Now we're done the depalpation. What we're doing now is the palpation of the liver. So always remember that we're always starting from the left lower quadrant and up. So still assume that the patient is in supine position. And then we're going to be palpating the liver to detect enlargement and tenderness. So first we stand at the client's right side. So we place a left hand under the client's back at the 11th of the rib cage. So starting from the right lower quadrant. 1, and up. Place your right hand parallel to the rectus muscle with fingers pointing toward the rib cage. So we ask the client to breathe deeply and press upward with your right fingers with each inhalation. Can you please breathe deeply?
Maintain your hand position and ask the client to inhale deeply while the client inhale. Feel the liver border for against your hand.
So during inhalation, we palpate the deep 4 to 5 centimeters. So next we do the palpation of the spleen. Again, stand at the client's right side. Reach across client to place your left hand under client's posterior lower ribs and push up. Then place your right hand below the rib margin. And ask the client to breathe deeply. So ma'am, can you please breathe deeply? So press hands together to palpate spleen on inhalation. Now after that, we're going to be palpating the kidney. So at this point, we're going to be using our both hands. So we place one of our hands behind the lower edge of rib cage and above the iliac crest. So we place other hand over the corresponding anterior surface. So first placing right here. And then the other one is placing right here. So instruct the client to breathe deeply. So ma'am, can you please breathe deeply? So lift up lower hand and push in with the upper hand as client exhales. So repeat on the other side. So in the other side, here, we note that the kidney are rarely palpable. After that, we're going to proceed to the palpation of the bladder. So first, we palpate the area above the symphysis pubis of the client who has a history of urinary retention. So above the symphysis pubis, normally there's no palpable. So after doing all the procedures, we thank the patient for cooperation. Okay, ma'am, thank you for your full cooperation. You can now sit down. After thanking the patient, we do the aftercare to the patient if unable to help save, or we ask the patient to do the aftercare if able. We ensure that the patient is on the comfortable position. So after placing the patient in a comfortable position, we do the hand hygiene. So assuming that we're already done doing the hand hygiene, then we document findings on the patient's record. So that is all for my video, and thank you for watching.